listen here. So we have been discussing about lifestyle disease, and we have seen that there are different types of lifestyle diseases are there here. We have a list of different type of lifestyle disease, and about some of the major disease we will be discussing now. Now we have also discussed what are the reasons for lifestyle diseases in last class. Then today we will begin with what are the major lifestyle disease. Here we have a list of some of the common lifestyle disease. An important type of lifestyle disease is known by the name Alzheimer's disease. Now in the case of Alzheimer's disease, it is as I already know, normally it is the important symptom of a Alzheimer's disease is memory loss. So this happens during older age. So it's an old age disease. In many families it is common. Now, so coming to the features of Alzheimer's disease, you can see that it is a form of brain disease. More specifically, we call it as a neurodegenerative disease. Here you can see that this is how a healthy brain will be appearing. Now in a neurodegenerative, degenerative means slowly the functioning will be lost. That is known as the degenerative, a gradual form of destruction. So in the case of this Alzheimer's disease, the brain cells are slowly destroyed over a period of 5 to 10 years. And what happens then is that the brain will not be able to carry out most of the normal functions. So that is what is happening in the case of Alzheimer's disease. Now it usually occurs during older age, and there is no specific treatment also for Alzheimer's disease. Now most of the time the disease will be starting with a loss of memory. So loss of memory is the starting symptom of the Alzheimer's disease. Sometimes what happens is that the person may be very good in remembering very old events, like what happens in the school or what happens in the college or when he was working in somewhere. Such events he may be able to see very clearly. But recent events, many of them may not. For example, somebody came to our house in the morning, and after some time, 1 hour or 2 hours, he or she may be asking, who has visited our house in the morning? So that kind of memory, which is known as a short-term memory, the memory of the very recent events will be normally lost. In many families, sometimes the girls will be coming from a different family. I have a case here, and usually that mom will be asking, who is that girl staying with you? Such kind of problems are there. So that kind of, but at the same time, very older events they will be able to recollect very easily. So this is known as the Alzheimer's disease, and normally what we have seen is that there is no specific treatment for this disease. Alzheimer's disease is that first it is starting with the loss of memory, then it can affect any part of any system of your body. Since brain is affected, the most of the systems of the body will be affected. And what happens after some years is that there is a gradual breakdown of the body. Like normal functioning of the body, like breathing, walking, then circulation, everything will be slowly will be affected, and finally will be resulting in the death of the person. So this is the problem of the Alzheimer's disease. And another characteristic feature of the Alzheimer's disease is that they will not have a sense of, for example, if the person is walking out of the house and reaches somewhere, most of them have so much difficulty in finding the road or route to their house back. So this kind of problem is there. So if they are moving out of the house, they will not be able to come back to the house again. So that problem is there. So it is just not simply a loss of memory, it can affect the life in a very significant way. And normally what is happening is that in the beginning stage, the person may be withdrawing from the society, a kind of social withdrawal. Then after some years we can see that the person is again withdrawing from the family. That is, he is not talking with anyone in the family. Most of the time he is alone, lonely in or her room. So that kind of family withdrawal is there. And finally, over a period of 5 to 10 years, usually result in the death of the person. That he or she may not be able to do even the basic life activities like brushing the teeth, or sometimes after some time even the breathing, circulation, everything will be gradually affected. Now here you can see that the brain cells are dying. Why the brain cells are dying, nobody knows. What we have seen is that in the brain, certain regions of the brain cells are getting destroyed, and there will be the formation of certain protein bodies within these cells. So it is by normally Alzheimer's disease is diagnosed by brain imaging, like brain scanning, and then during brain scanning, doctors will be checking for the presence of these protein bodies in the cells. So if it is present, that is an indication that the person has Alzheimer's disease. So this is one kind of lifestyle disease. Normally we don't have a proper treatment, but you can see that good nutrition and would may have an important role in slowing down the disease. Nobody can completely prevent the disease, is impossible, but we can slow down the progress of the disease. So normally, if the death is happening in 10 years, if we are taking a lot of care, we can prolong it to 15 or 20 years. So that is that is the best that we can do in the case of Alzheimer's disease. Then we have another kind of disease known by the name arteriosclerosis. So here you have a normal artery, and you also see an affected artery affected by arteriosclerosis. So here what is happening is that, plaques, sometimes you may have heard about this term known as plaques, or otherwise known as atheromas. Plaques are actually the deposition of the fat. The fat particles will be deposited on the inner side of the wall of the artery. And what happens is that when these fat particles are deposited here, that will be reducing the opening of this artery, so that less amount of blood can pass through that artery. So that is the problem with plaque deposition, and this plaque deposition are normally through cholesterol deposition. Cholesterol is a kind of fat. So when this too much cholesterol is present in the blood, some of the cholesterol will be deposited on the inner wall of the artery, and that will be reducing the diameter of the artery or the opening of the artery. That means very little amount of blood can pass through that blood vessel. So when little amount of blood is coming through that blood vessel, the organ to which that blood vessel is connected may not be receiving sufficient quantity of blood, and that will be resulting in the poor function. For example, if it is to the kidney or if it is to the heart, and if heart is not receiving sufficient amount of blood, what happens? Heart may stops working, which we call as a heart attack. So such kind of problem may happen in a case called as arteriosclerosis. So normally the arterial wall has an elastic nature, just like the cycle pump or cycle tube you take. If it is filled with the water, it will be elastic. That is how normally this our blood vessel. But because of the deposition of this fat or cholesterol, this elastic nature of the blood vessel will be gradually lost, and arteries become more rigid or more stiff, so that it cannot expand. So that also reduces the ability of the blood vessel to carry more blood. And what happens is that the organ to which that blood vessel is going will not be getting sufficient quantity of blood, and it will not be working properly. And this is the problem. If it is to the heart muscle may not be getting sufficient quantity of blood, and that will result in known as angina pectoris, called as heart pain or chest pain, and sometimes heart attack or other kind of complication is there. So normally arteriosclerosis usually occurs with the aging. So during aging, so a lot of problems are there, but this is one problem. And here you can see that what are the contributing factors. One is overweight. Overweight means more fat is present in our body. Second is high blood pressure. High blood pressure is a contributing factor, and also diabetes. So these are the three important factors that prompt this formation of this plaque formation and resulting in arteriosclerosis. Now arteriosclerosis usually it can cause a lot of heart related problem, and what happens is that most of our heart attack or stroke are somehow related with this cholesterol deposition, or known as arteriosclerosis. So this is also a lifestyle disease, because we are taking more amount of fat. We are not keeping our body. For example, normally there is a very simple rule for what is optimum weight. For example, if your height is 165 centimeter height, 165 centimeter is the height of the person, then the weight that you are allowed is 65. Just reduce 100 from it minus, then we will get the optimum weight. If your height is 170, the weight allowed is 70 kg. If your height is 150, weight allowed is 50 kg. So that is how we can find our ideal weight or optimum weight. And if your weight is increasing more than that, then gradually some kind of complications will be there. There will be development of blood pressure, there will be cholesterol formation, overweight, there will be back pain, there will be knee problem. So all these are because of overweight that we are not keeping in control. The overweight that we are not keeping in control. Now we move to another one, is the cancer. So you know that why people are dying in our society. Most of them either die to stroke, heart problems, or cancer. So cancer is an important type of problem that is leading to death of many people. Even though we have a little advancement in cancer, still it is a dangerous disease. If somebody is affected with cancer, we will be very much worried, because we know that the probability of survival is very less, but we can only prolong it to some extent. So what is actually cancer? Because it is an uncontrolled abnormal growth of cell. For example, in the case of every cell, for example, you take a nerve cell, or you take a skin on your stomach cell. Any kind of cell you take, normally what is happening is that after certain times of multiplication, imagine for 100 times, 100 times of multiplication, that cell will normally die. So that is how the body, the nature has programmed all these cells. The cell can multiply only up to 100 times. So after the 100 times it has to die. In the case of cancer cell, this process is not taking place. That is, that cancer, if a cell becomes cancerous, even after 100 cell, even after 100 multiplication or 1000 multiplication, the cell keep on growing. It keep on dividing and it forming new cell. So that is mainly the problem. That is why when a part of your body is affected by cancer, you can see that that part is increasing in size, because cells are multiplying in an uncontrolled manner. So that is why uncontrolled abnormal growth of cell. So normally in our body, sometimes some cells become cancerous, and our immune system has a ability to find out these cancerous cells and immediately kill it or destroy it. So normally this is how our body is controlling cancerous cell. But sometimes our immune system may not be effective in finding out, or may not be effective in destroying it, so that these cancerous cells will multiply. And their multiplication will be resulting in abnormal enlargement of that particular region of the body. And what happens is that we can cite enlargement or bulging. And this is how the cancerous cells is there. Then another type of cancerous cells is that many cancerous cells have a problem, that is when they are multiplying in large number, certain portion is may be detaching from that, and that detached cells may move through blood vessel to any part of the body, and if they are attaching to some another, for example, a cancerous cells present in the lungs or in the liver, it is detached, and that is reaching for example of thyroid. In the thyroid it will cause the development of cancer. So that kind of problem is also there. So this is how, and that happens during a later stage. Sometimes doctors say that it is in the stage 3, that is the cancer is in the spreading stage. Not much, very little can be done. So that is why so in the initial stage the cancer will be highly localized. If it is in the liver, it will be only present in the liver cell. It won't be affected. But in the stage 3, more in advanced stage, it slowly start detaching from the original site and moving to another part and causing spreading of cancer all over the body. So that resulted in the death of the person slowly. We can see that there are 1,150 different kinds of cancers are there, and normally in our present technology we have only a very crude method of treating cancer, because what we do, if a part of the, for example, a breast is affected, then what we do, we are removing that breast. What the organ that is affected, we are removing. If our liver is that part which is affected by the cancer is gradually being surgically removed. Same is the case with the stomach. So that kind of very crude approach is only present there. Another technique that we are using is destroying with the help of radiation. That is gamma rays or cobalt 60 rays, or our radioactive waves will be beamed on the cancerous cells in a very pointed manner, destroying the cancerous cells only. So that is another technique. Then we have also another kind of cancerous technique which is not so common, but still it is present. That is, we use certain antibodies, and these antibodies will be tagged with certain chemicals, cancerous cells killing chemicals. So when we are taking those antibodies, these antibodies linked with these chemicals will be going to the specific cancer cells and only destroying that particular cancerous cells. These are the different type of approaches presently we are using for treating cancer. But still, if you know that cancer, if somebody is treated with cancer, for example, you are having a chemotherapy or a radiation therapy, you know that there will be a lot of complication. You can immediately notice that the hair of the person may be lost, the skin of the person may be very dark. So lot of which is called collateral. That is, if the primary organ is being treated, lot of other organs will be also affected. So that kind of problem is, for example, you want to kill only one cell. Not only that cell, many other neighboring cells may also be dying. So that is the problem of our present approach of cancer treatment. That is why cancer is still considered as an important problem. So what we can do is that we can make sure that we are taking care of our normal life in a proper way. So if you are taking care of our life in a very proper way, we won't be having this kind of problem. So that is the case with the cancer. So for example, many people, we know if you are smoking is a cancer triggering case. Then certain kind of drugs will be there. Then chewing of nutmeg, then tobacco leaves. So then all these, then working in certain kind of chemical factories, working in an environment where high radiation is there. So all these are cancer promoting situation. The best thing that we can do is that avoid living in such situation. So that is the only thing because there is no meaning in fighting with the nature. Because recently we have a landslide. We cannot fight with nature. Human being is just a part of nature. If we accept and live according to the rules of nature, I think everything will be fine. But on the other hand, if you go challenging the nature, slowly it will be affected. So in the case of cancer, we know that what is the good, what are the different type of food which are advisable, what should not be taken. For example, smoking is, everybody knows, it is written on the packet. Still many people are taking. So problem is that when somebody in your family is affected by cancer, usually the income of that person may not be there. I know several cases there. Then what happened? Another person who has done a normal, who had a very perfect life, will be normally bearing the burden of his or her own personal mistakes. If father or mother or husband or wife, if they are smoking, who will be the suffering? Other members of the family who have done no mistakes in their life will be usually paying the price. So this is how our life is going. So we have to make sure that we lead a perfect life. We take care of the normal important things which are supposed by anybody in our life. Then we go to the next type of problem, that is the heart diseases. So different type of heart diseases are there. Here you can find some of the most common type of heart disease. One is heart failure. Heart failure, what happens is that heart is not working. Because if heart stops working, that is known as heart failure. Then there is heart attack is there. Normally what is happening in the case of heart attack, here you can see that in a heart attack, what is happening is that blood flow to the heart. The blood flow to the heart may be stopped. When blood flow to the heart is stopped, what happens is the heart muscle may not be getting sufficient quantity of blood. When sufficient quantity of blood is not reaching your heart muscle, it may not be able to work. It may not have the energy to work, then it stops working. So that is known as a heart attack. So if heart is not contracting, no blood will be pumping out of the heart. So that will be resulting in heart attack or heart failure. So this is not, the most important reason is the atherosclerosis. Sometimes doctors say there is a block in your heart. What simply means some fat particles are blocking the transport of blood to your heart muscle. So that is a heart block. Then there is another problem is known as a stroke. Stroke is also similar to the heart here. Here what is happening is that some artery that is going to your brain, supplying blood to your brain cells are affected. A block will be developing in that brain artery. So what happens is that sometimes because of the pressure, because when the block is there, blood will be accumulating. Blood will be accumulating at the region before the block, and after some time it will be bulging and it will be rupturing, and a lot of blood will be leaked into the brain cells. And what happens is that when blood is present in the around the brain cell, they may die. And this situation of death of brain cells is known by the name stroke. So this sometimes people say that he or she had a stroke. Stroke simply means some blood vessel in the brain is ruptured and a lot of blood has leaked into the brain cells, so that the brain cell may not be able to work. They will also die. So this problem is known as a stroke, and stroke is also a major cause of problem. And here also the stroke is related with our heart, working of the heart or circulatory system. Then we have aneurysm. Aneurysm, we can see that there is a bulging in the wall of your artery. So that kind of problem is there. Then peripheral arterial disease. When you develop peripheral arterial disease, your extremities means your hands or legs, they won't receive enough amount of blood. For example, if you go to the Arctic region and you are walking without a proper insulated cloth or insulated shoes, the first thing that may be affecting is that when in such an extreme climate, your legs may not receive enough amount of blood. If enough blood is not reaching your legs, then slowly over a period of time they will die. So a similar kind of problem is that when your extremities, your legs are not getting enough amount of blood, that will cause this peripheral arterial disease. So this is not only there will be pain while walking, claudication, that is the term that doctors are using. So this that peripheral means outer organ. When peripheral organs of your body are affected, we call it as peripheral arterial disease. Then sudden cardiac arrest is the sudden unexpected loss of heart function. Breathing conscious often caused by arrhythmia. Arrhythmia means no rhythm. It's no rhythm in the heart. That is known as arrhythmia. So these are some of the major problems associated with our heart. We can also see that these are then valve diseases there. Some people may have, that is the most of the time valve disease may be a genetic problem. Some children may be having right from the time of birth. The valve that is separating your auricle and ventricle, they may not be working properly. Then in such situation what happens is that the blood, there is improper mixing of blood, and that will be also creating the poor ventilation, poor circulation, poor oxygenation of cells. So these are the problem. Then you can see that pericarditis. The pericardium is the outer membrane that is covering your heart. When that has an inflammation, some disease is affecting it, it is known as a pericarditis. Then here you can see thickening of the myocardium. Myocardium makes this this part is known as a myocardium. When there is too much thickening there, it is known as a cardiomyopathy. Then when disorganized electrical signals, see, heart is also working using certain electricity and very weak electricity. If that weak electricity is not in an organized way, then that will be creating problems for the working of the heart. So these are some of the problems associated with the cardiac arrhythmia. So these are, because in every case the major reason for heart disease is lack of exercise, overweight, extra amount of cholesterol, presence of high blood pressure. These are the normal contributing factors for heart disease. Heart disease may not occur if the person is healthy, and if the person is taking care of his weight, if the person is keeping blood pressure under control, diabetes under control. So only when we ignore these normal aspects of our life, the heart diseases are usually developing. Then I think that is sufficient for today. We will stop here. We have few more diseases.